Today I'm going to talk about questions to ask after diagnosis of cancer. Life is a journey with a starting and an ending. Consider yourself traveling along this road in a car from point A to point B. What can pose a risk to your life during this journey? One, the road itself, whether it's a one-way road or a two-way road, whether it is a national highway or a street road, the car, the family car or a sports car, what speed you're traveling in, and finally, the driver. Are you drunk or are you sober while driving? All these three play a major role to determine the risk to your life. Now, when you add cancer, the car represents the type of cancer, the road represents the stage, and the driver the cause of cancer. So, questions to ask after diagnosis of cancer are: what is the type, what is the stage, and what is the cause of cancer? The fourth question is: what is the stage of cancer? In this journey, from starting to ending, you can divide the road into two parts, the early phase and the late phase. Remember, the further cancer travels this road, the more difficult it is to cure it. In the early phase, you've got stage 1 and stage 2. In the late phase, you've got stage 3 and stage 4. Stage 1 and stage 2 are called early stage cancers. Stage 3 and stage 4 are called advanced stage. As we go from early stage to advanced stage, the survival decreases and the intensity of treatment increases. In early stage, less treatment, more survival. In advanced stage, more intense treatment, less chance of survival. How to know the stage? In solid cancers, we have a scan called PET-CT scan. This scan helps us in finding out where the location of the tumor is and where it has spread to. Also, it gives information on how active the tumor is. Before we go into the details of staging, the simple principle of cancer treatment is: you have got cancer, you undergo treatment, and you're cured. This ideology is wrong. Actually, your tumor is controlled first, and then you may either get cured or not cured. What determines whether after treatment your cancer is cured or not? Time. And the time is 5 years. After 5 years or during that time, if you have no progression or recurrence, you're cured. If you have progression or recurrence of cancer, you're considered not cured. It's a game of waiting. As they say, good things come to those who wait. 5 years is the key here. What do I mean by progression and recurrence? So let's just say after treatment, within 5 years, your cancer has come back in the same area. It is called recurrence. And if your cancer has spread to a different area, it's called progression. The key factor is 5 years. If you have no cancer for 5 years, you're cured. If you have cancer within 5 years, you're not cured. As we treated so many cases over the last 60 to 100 years, we are able to predict which patients are getting cured or not cured. To know what percentage of patients get cured, we must know the stage. The stage is a representation of your chance at getting cured. In stage 1, the chance of getting cured is between 80 to 99%. In stage 2, it is 60 to 80. And stage 3, 20 to 60. In stage 4, it is even less than 20%. I know a lot of numbers. To make it simpler, just remember, going from stage 1 to stage 4, the chance of cure decreases. You have got a higher chance of cure from stage 1 to stage 3. In stage 4, there is less chance of cure, but still there are some exceptional cases. Just as water moves in one direction, from high places to low places, so does cancer staging. That is, cancer goes from stage 1 to 2 to 3 and 4, and not the other way around. Why am I emphasizing on this? Because recently I had a patient who had a stage 3 cancer after good treatment, and once the cancer regressed, the patient's son asked me, now the patient has stage 1 cancer. From this, I hope you understood that cancer always moves forward or stays there. It never goes back. So, stage 3 is always stage 3. It can go to stage 4, but it cannot go back to stage 2. If we can understand what is stage 4, it becomes easy to understand what the other stages are. So what defines stage 4 is involvement of other organs, nodal involvement, and local infiltration. Complicated terms, I will try to explain them in the simplest way possible. Organs. So the various organs in the body like the heart, lungs, stomach, your intestines, bladder, skin, muscle, all of these constitute organs. For the purpose of understanding what is staging, let us consider each organ as a house. For example, consider this house belongs to breast. Then there is another house which belongs to the organ called lung. When a cancer begins in the breast and spreads to the lung, it is called stage 4 cancer. what are the various organs that can be involved? Some examples are bone, liver, lung, and brain. In stage 1, 2, and 3, other organs are not involved. In stage 4, other organs are involved. So now that we understood what one of the factors that define what stage 4 is, suppose organs are not involved, then can we still say it is stage 4? Yes. Here comes the nodes. The nodes run everywhere through your body, just like your blood vessels. They run parallelly to blood vessels. They help fight infections. If the house is an organ, the garden are your nodes. For example, in breast, the axillary nodes are your local nodes, and for lung, the chest nodes are your local nodes. When the local nodes are involved, it becomes stage 2 or stage 3. In stage 1, the local nodes are not involved. In stage 2 and 3, the local nodes are involved. Suppose in breast cancer, the chest nodes are involved. It is called the distant nodes being involved. Same way for lung cancer, if the axillary nodes are involved, it is called distant nodes being involved. If the distant nodes are involved, it becomes stage 4 cancer. So, for a breast cancer, the chest nodes being involved, and for lung cancer, the breast axillary nodes being involved makes them stage 4. Distant nodes are not involved in stage 1, 2, and 3. Distant nodes become involved in stage 4. So now that we have understood how nodal involvement helps us in defining stage 4, coming to the last factor, local infiltration. So tumor begins out very small, it keeps increasing in size, and finally it becomes so large that it infiltrates the surrounding structures. For example, in lung cancer, it can infiltrate the surrounding heart, your foot pipe, the bones. So it's called infiltration if it goes into another organ. As the size increases, the stage also increases. Finally, when it comes to infiltration, it can either be stage 3 or in rare cases it can also be stage 4. Depends on the location of the tumor. For example, consider two patients. Both of them have got breast swelling. We did a biopsy. It came as invasive ductal carcinoma. In the first patient came as stage 1. The second patient it came as stage 3. Can you tell me which is bad and which is good? Stage 1 is good and stage 3 is bad. We can also tell the amount of tumor there is based on some hormones. If the said cancer secretes those hormones, examples are CA19.9, 15.3, calcitonin, alpha fetoprotein. Finally, coming to blood cancer. In blood cancers, this journey can be divided into 3 parts: low risk, intermediate risk, and high risk. This is based on the genes. If you have low risk genes, it becomes low risk cancer. If you've got high risk genes, you've got a high risk cancer. As you go from low risk to high risk, your survival decreases and the intensity of your treatment increases. That is, in low risk, for little treatment, you get greater survival. For high risk, you have to go to great lengths of treatment to get the minimal survival. How to know what risk you are in? This can be done by studying the genes, and the test that helps you study the genes are NGS or RT-PCR. I hope I could explain to you what staging in cancer is, how to stage a cancer, and for blood cancers, how to risk stratify them as low and high risk. Coming to the fifth question, what is the type of cancer? Assume 2 points A and B. The red car takes its time going from A to B, while the blue car, in a matter of seconds, goes from point A to point B. The difference between the two is the speed. Based on the speed, we've got various types of cars: a vintage car, family car, sports car, or an F1 car. Similarly, in cancer, how fast does the cancer grow from stage 1 to stage 4? The red car stops at every stage, while the blue car, it just passes through stage 3 and reaches stage 4. So again, the difference here is the speed, based on which you have got various types of tumors, like a very slow growing, a fast, and a super fast growing tumors. For example, of a slow growing tumor, it takes 5 years for it to grow from stage 1 to 2, 2.5 years to grow from stage 2 to stage 3, and 1 year to grow from stage 3 to stage 4. While a fast tumor takes exactly half the time that a slow tumor takes. So, in the end, a slow tumor will take 8.5 years to grow from stage 1 to 4, while a fast growing tumor takes 3.5 years. So, how to know whether it is a fast or a slow growing tumor? In oncology, for both solid and blood cancers, after a biopsy, we've got various tests like a FISH and an IHC test, which are gene tests and protein tests to tell us how fast the tumor grows. In recent years, we've got gene testing called NGS and RT-PCR, studies the genes in more elaborate ways and gives us more information. So we are able to tell the type of tumor more precisely with the help of these tests. Consider an example of 3 patients, all of them have a swelling in the breast. We did a biopsy, and for the first 2 patients, it came as invasive ductal carcinoma, and the third patient came a different type called small round cell. We did special testing, in this case, protein testing by IHC, which came as hormone positive in the first patient, hormone negative, also called triple negative type in the second patient, and in the third patient it came as lymphoma. What is the type of tumor? Hormone positive is a slow type, triple negative is a fast type, and lymphoma is a super fast type of cancer. So then comes the question, can a slow growing tumor become a fast growing tumor? Yes, if you change the engine. Sometimes the tumor may look like a slow growing tumor, but it may be super fast. This causes a lot of confusion on oncology. You have to pause and decide on what type of treatment to be given. Coming to the sixth question, what is the cause of cancer? There are two main factors, genetic and non-genetic. Genetic factors, it implies there is a genetic defect, and this defect can run through your family. For example, if any of your first degree cousins, your second degree cousins, multiple of them have cancers, it can point towards a genetic defect which has to be proven. Non-genetic factors are habits that you acquired which led to cancer. Example, smoking, alcohol. To understand this better, consider genetic factors as a taxiwala and a non-genetic factors as a worker. A worker has one job, to go from home to office in a single road which he usually doesn't deviate from. So in non-genetic factors, you've got a single cancer. Usually it is one type of cancer, and the risk factors are the cause of cancer, like smoking, alcohol. Non-genetic factors, taxiwala, he goes from wherever he wants to another place. There is no set direction. He goes at whatever pace he wants to, fast or slow. In that sense, you've got multiple cancers, multiple type of cancers, and the cause here is a genetic defect. So having a genetic defect is very risky, not only for the patient but also to the family members. Finally, coming to the overall picture, combining the knowledge that we have acquired so far, type, the stage, and the cause. Solid cancer, the slow and the very slow type. They stop at every stage 1, 2, 3, and 4. So you can have cancer at any stage, and say you don't take any treatment and let the cancer grow as per its natural course. It can take about 10 years for the cancer to go from stage 1 to stage 4. Say if you do take treatment at the early phase, you gain about 30 years, and if you take treatment in the advanced phase, you gain about 20 years. So in total, around 10 to 20 years you gain by taking treatment. And whatever the stage, the control rate is high. Coming to the fast type, by the time you realize it, it is either at stage 3 and stage 4, very rarely at stage 2. And say you don't take any treatment, let the cancer go by its natural course, about 5 years. You do take treatment at the early stage, then you gain about 10 years, and in the advanced phase, say about 7 years. With treatment, you gain about 2 to 5 years. The control rate depends on where it is located, but overall, it is an intermediate control rate. Finally, coming to the very fast type, by the time you realize it at stage 4, rarely can you catch it at stage 3. So, overall, it's an advanced stage. Finally, if you don't take treatment, it takes about 1 to 2 years to reach stage 4. Say you do take treatment at the early phase, meaning you go through screening and you end up getting diagnosed at stage 2, you gain about 5 years, and in the advanced phase, say about 3 years. In total, about 1 to 3 years of time can be gained by taking treatment. The control rate, since you're catching it at an advanced stage, it's low. For example, consider 2 patients, all of them have a swelling in the breast. They did a biopsy, it came as invasive ductal carcinoma. The first patient, it's a slow growing type called hormone positive type, and in the second patient, it's a fast growing type called triple negative breast cancer. The staging is stage 3. So, what is the prognosis, the overall effect of all of this information? In the first patient, since it's a slow type, despite the stage, it is good. And in the second patient, since it's a fast type and you have an advanced phase, it is bad. Remember, good or bad, you always have a chance of cure. The chance of cure is higher when it is the good type. Also, cancer has started this war. Taking too long in taking a treatment decision might reduce your chance of cure. Thank you for being patient and watching this entire video. Next, I'm going to talk about treatment of cancer in my next video. If you do like this video, kindly like, share and subscribe. Thank you.